Have you ever heard about polyhydramnios condition in a pregnant woman? Yes, it is a condition where the water levels around the baby has increased more than the required levels. This condition can occur in 1 in 100 pregnancies, and it can be associated with many fetal and maternal condition, and it can lead to preterm deliveries, and excessive water levels can lead to preterm rupture of the membranes and leaking of water. Hello everyone, myself Dr. Kiran Chittala, fetal medicine consultant, New Era Hospital from Nagpur. Welcome to our channel. Please do subscribe our channel for regular updates on maternal and fetal medicine. In today's video, we are going to learn about how the water levels are forming around the baby and what are all the conditions associated with the increased water levels or decreased water levels. So, these water levels in the first 3 to 4 months, they are formed from the maternal tissues like placenta, membrane, fetal skin, etc. Once the fetal kidney starts functioning, main water content will be from the fetal urine. There are two conditions which can be associated with water abnormalities, liquor abnormalities in the pregnancy. One is polyhydramnios and second one is oligohydramnios. Polyhydramnios, which is increased water levels, and oligohydramnios, which is decreased water levels. In today's video, we are going to discuss more about polyhydramnios. How do we check the water levels in the pregnancy? There are two indices which are helpful. One is amniotic fluid index, second one is deep vertical pocket measurements. If the amniotic fluid index crosses more than 25 centimeters, then it is called as a polyhydramnios, or DVP, deep vertical pocket. If it is more than 8 centimeters, then also we can call it as polyhydramnios. In 80% of conditions, it is a mild polyhydramnios. In 15% of conditions, it is moderate polyhydramnios, and remaining 5% can be associated with severe form of polyhydramnios. There are many conditions which can be associated with the polyhydramnios. Those are fetal conditions or maternal conditions, those are from the mother. Fetal conditions are like brain abnormalities, lung abnormalities, GI abnormalities, or any other skeletal dysplasias which can be associated with the decreased fetal movements. In these conditions, baby is not able to swallow the water, so there will be accumulation of water around the baby. In the maternal conditions like increased sugar levels like diabetes, uremia, placental tumors like chorea hemangioma, TTTS, that is a twin transfusion syndrome, which can be associated with the twin pregnancy, or fetal anemia where RH elimination can happen, and this can lead to polyhydramnios in the pregnancy. How to follow these conditions? One should follow with detailed anomaly scan, and second one, whenever there is anomalies associated with the polyhydramnios, one should go for the invasive testing for karyotyping and microarray for genetic abnormality. And maternal sugar levels testing also we should do by oral GTT test, and torch infection testing which can be associated with the polyhydramnios. Once we have diagnosed the polyhydramnios, we have to follow the pregnancy once in 2 to 3 weeks interval with the ultrasound for the monitoring of liquor, that is water levels, and the cervical length. How are we going to treat the polyhydramnios in the pregnancy? It depends on the cause, whether it is a fetal or maternal. If it is a maternal, we have checked the sugar levels. If it is high, we have to maintain the maternal glycemic control. And if it is a fetal cause, if there are any treatable cause, that is like fetal arrhythmias, fetal anemia, or fetal lung tumors, which can be treated by shunting procedures, we have those options available. And there are invasive procedures like amnio drainage, where if mother is having excess breathing problem because of excessive water, then she can go for amnio drainage, or medicines like endomethacin, but they should be used under doctor's guidance. And such pregnancies should deliver in a tertiary care center. And prognosis for the fetus depends on the cause of the polyhydramnios. If it is a fetal cause, definitely prognosis varies, and if it is because of the diabetes and maternal diabetes, the prognosis will be good. If it is a idiopathic condition, the recurrence in the next pregnancy will be very less, and if it is associated with any genetic conditions, then the recurrence depends on the inheritance of the genetic condition. So moms to be, if you are diagnosed with a polyhydramnios condition, no need to panic. We are there to help you to monitor your pregnancy further. If you have any queries or comments on this topic, polyhydramnios, please do write in our comment box. Thank you.